Hi there, my name is Bob Nelson. A lot of people know me from my music as Robert K. If you're a medical professional, you probably know as Robert K. Nelson. They're all correct. So, anyways, I want to tell you sort of my interesting, very unusual cancer story, which I'm still dealing with, but yeah, it's a very unusual situation. So in middle of August 2020, I was diagnosed with renal clear cell carcinoma that had metastasized into my lungs. And so it was actually the spot in my lungs that triggered them to find the cancer. My GP had sent me in for a scan just to check on my heart, and they saw in one of my lungs just a spot they thought was suspicious, so she sent me for a full scan. The interesting thing about the story, sort of humorous, I was in the same day that I had the scan done. I had been in for a day procedure to have some kidney stones removed from my right kidney, and my urologist was so tickled that she had done such a great job of cleaning all these stones out of my kidney, and she didn't know that it had a big cancer tumor on it. So when they did the scan, they discovered, which I got the afternoon after I'd had the kidney. I went straight from the clinic, when I woke up from having my kidney stones removed, went straight to the imaging department and had my scan done, and where they found the cancer. So I sort of felt bad for her because she felt so good looking at the inside of the kidney about the job she'd done, and we found out that the kidney had cancer. So, and I was passing all kinds of blood clots and stuff. So they very quickly, within a month of being diagnosed, they removed my right kidney, and I still have the little specks of cancer in my lungs. So after the kidney was removed, they put me on a combination therapy, which is the recommended therapy for this type of cancer, which usually is very effective, where they give you an oral chemo drug that you just take at home, just pills, and then every few weeks you get an infusion of what they call immunotherapy, and the drug for that is called pembrolizumab. So PEMBROLIZUMAC, and that's important in my little story. So they started me on this, and I'm a singer, and the first thing that happened was the chemo drugs made my voice really hoarse and scratchy, and if I wanted to do Tom Waits songs, I guess it'd probably be okay, but I couldn't sing. And so we stopped that. We kept doing the immunotherapy, and I had 3 infusions of the immunotherapy. And then about near the end of November, I ended up in emergency because of severe shortness of breath. Now, I'd had shortness of breath coming on, and I thought, well, you've been so sedentary for so long that you're just really badly out of shape and you need to exercise. But this was something I could tell was more than that. And I couldn't, if I laid flat on my back, I couldn't breathe. And so it was really quite severe. So I went into emergency, and they were great. They triaged me in right away. Usually, anyone who's been to emergency at one of our hospitals know you wait sometimes for hours to be seen. They got me in right away because they thought I'd had a heart attack. They did some blood tests, and the enzyme that is the key to tell you've had a heart attack was very high. And so the emergency doctor said, "Well, you've had a heart attack," and I went, "Really? I didn't feel it." So anyway, he said, "Yeah." So they sent me to the heart unit at the Jubilee Hospital, and they did an angiogram, and they put in a small stent, and were expecting that my symptoms would improve. They didn't improve at all. Nothing changed. They did send me home a few days later, and within a couple of days, I was back in emergency because I couldn't breathe. I had a chiropractic appointment, and I was sitting in the parking lot outside the chiropractor, feeling so sick, and knowing that I couldn't lay down on the chiropractor's table to have to be adjusted. So I called and I canceled the appointment, drove straight to emergency, and that began a 3-month odyssey in the hospital. So they let me out for 2 days for Christmas, and I was so sick, I ended up back in right after Christmas. On Boxing Day, I went back in. So, so they're still treating the tumors in my lungs. So the symptoms that I was having was this really shortness of breath. That was the thing that triggered everything. And I didn't realize what would happen as it progressed, because I started to lose all the control of my facial muscles. My face drooped. I was slurring my words. They thought I might have Lou Gehrig's disease, or there was a whole raft of things they thought that I might have that was causing these symptoms. And every time they would deal with one of those, give me a new medication or new treatment, I just got sicker and sicker and sicker. And for the first 2 months, they didn't allow my wife to visit me because of the COVID restrictions. So we could only talk on the phone. But they were concerned about my mental health as my health continued to deteriorate. And so they thought that if they made special exception for my wife, and let her come in to visit, it might perk me up and help my mental health and therefore my ability to recover. I was really grateful for that, but I still got sicker and sicker. And one night, Margaret was visiting me. She thought maybe she should stay overnight because I might not be alive the next day. And my doctors all were really afraid I was going to die. And it was like an episode of House, if you ever watched the TV show House, where they have some person comes in and it presents as one thing, but it's not that thing, and they try a whole bunch of other things, and it's not that or that or that, and have to finally discover what is the problem. And I was one of those cases. And so finally, after 3 months of this just terrible journey going downhill, and just figuring I'm not getting out of here. My neurologist prescribed intravenous immunoglobulin. Now, it's an intravenous. They just give it to you intravenously. It's this clear liquid, comes in a bottle. And I remember the nurses the first time, they're holding these little bottles. Don't drop it. That's worth $15,000. And so it's very expensive. It's a blood product. It's human antibodies. So when your body can't create its own antibodies, they give you this, and it really helps. So anyway, it was after 3 months of being in the hospital, and they finally gave me this IVIG. It was like magic. They gave it to me for 2 days in a row, and on the third morning I woke up and I felt so much better. And you could see it in my countenance, to the point where I was having doctors and nurses and people who had dealt with me come in, just look in my door and see that, I didn't look like I was going to die anymore, because I was really sick. They had a psychologist coming to see me every day just to try and help me not give up. And they gave me a private room, and they let Mark visit me, and I had her bring my guitar up. And I tried to play and sing it. Oh, it was so bad, because my voice was this croaky. But anyway, they sent me, after about a week after the IVIG treatment, they sent me home. And of course, my music is important, and I play guitar, and I play saxophone, and I sing. And so I couldn't sing very well. And when I first picked up my saxophone and put the mouthpiece in my mouth and tried to blow, I couldn't form a seal around the mouthpiece. So I would go out in the car every day with just the mouthpiece and squawk on it until I started to get some control again and build those muscles back up. That's that's in music. That's called the muscles in your face and your lips is called your embouchure. So, and it was interesting. While I was in the hospital, my wife would go around with her computer to all the doctors and nurses and show them videos of me singing to show this is who we're trying to save, not the sick guy in the bed. This is who this guy is. And to this day, when one of my specialists will call me, they'll ask, "How's your voice?" Which is kind of funny. Anyway, so it turned out that the pembrolizumab had triggered a condition called myositis, which is severe muscle weakness in all your muscles. So I couldn't, well, as I said, I was having really bad shortness of breath. I couldn't take a deep breath at all. I couldn't even sigh. When you sigh, you take a deep breath, you go, I couldn't do that. If I was laying flat on my back, I couldn't breathe at all. And that made when they wanted to do, scans on me to stick me in the machine, I couldn't lay flat on the bed to do it. They wanted to do, scans, and they'd get me in the room and they'd lay me down flat on the little bench that zooms into the machine, and I would freak out because I couldn't breathe. And it was, and you don't think about this, but you don't realize all of the body functions that don't work very well if you have no control over your muscles. It's amazing. So they did send me home, like I say, after about a week after the IVIG treatment, and I kept working at it and it took me several months to get my voice back, and it took me a few weeks to get my embouchure till I could play my sax again, and since then they gave me IVIG treatments, outpatient IVIG treatments for the next nearly year and a half, and that seemed to work okay. I was able to function pretty well. I got back to playing I played in a big band in the sax section, and I was able to do that. And then about 6 months ago, they decided to wean me off. They start to wean me off the IVIG. I don't think it was because of the expense, and I'm so grateful that I live in Canada. Otherwise, I probably would have had to sue the oncologist in order to get the IVIG treatments because they're so expensive. And I don't know how long, their insurance programs down there would pay for it, if you run out of benefits. So in Canada, we don't have that problem. So, and I was concerned about the expense, and they just said, don't you worry about it. And I guess there's part of me that goes, well, you gave me the condition. I'm not going to worry about it. So at any rate, they've been really good. But I was on this every 8-week things for 6 months. And what would happen is after 3 or 4 weeks, I'd start to go down. I could feel my energy, losing energy, and my weakness getting a bit worse, until by the time we got to, just before I got another treatment, I was really sick. And I complained to my neurologist about this, and I think they were sort of hesitant, or maybe just because I'm a fat old man, I don't know, that they, but finally, my wife, Marg, the last time, just a few weeks ago, got on the phone with the neurologist's receptionist, and she was very concerned and sort of frantic, and she let all that franticness out and really complained loudly to the receptionist, who I'm sure communicated that to the neurologist, who within a few days of her making that phone call, they had rescheduled me back to every 4 weeks. So I've just started that now. So I'm hopeful that that'll allow me to function again. During the last 6 months, I've been so fortunate to have found 3 people who are willing to be so patient with me. I've got a drummer, a bass player, and a keyboard player. We have a little 4-piece band. It's called Blue Soda. I feel like I really haven't kept up my end of things with that, and but they've been so kind and so patient, and it's really because when we can get together and play together, it is so therapeutic for me. Music is my main form of therapy, and so I am now on a very mild chemo drug combined with cannabis, a cannabis regime where you take cannabis capsules as suppositories, and I took one orally and I got so stoned. That was terrible. And I was going, why would people do this to themselves? But when you take it as a suppository, you don't have any side effects. It doesn't make you stoned. So that's great. So my last scan came back, and the cancer that's still in my lungs, which it's totally, if I didn't know from the scans, I would not know I have cancer. It doesn't give me any symptoms at all. My problems are all from the cancer treatments. So they tried to put me on a regular dose of this drug, and it made me so sick that I couldn't function. So I'm really down on a low dose of it and doing the cannabis. But the last scan that I had, I've been doing the cannabis for a couple of months. The last scan that I had, the tumors basically hadn't grown, and there were no new tumors, and there was a little bit of growth in a couple of them, but much less than the scan I'd had the 3 months previous. So they do them every 3 months. So the 3 months previous, they'd grown more. This last 3 months, they'd hardly grown at all. So that's a hopeful thing. I'm now counted as stable by my oncologist, and so we'll just keep watching things. Anyway, so I disappeared from the music scene here in Victoria for 2 years, and I'm just hoping now that I've got on the IVIG. Oh, that's another thing I wanted to mention. I asked my neurologist if the myositis was going to be chronic. This is something I deal with for the rest of my life. And he just looked at me and shrugged his shoulders and said, we don't know. There isn't enough data. You're such a rare case that we haven't got enough data to know if this is going to be chronic or not. But I've had the treatment almost 2 years ago to the day. Within a couple of weeks it'll be 2 years, and it seems pretty permanent to me after 2 years, and I'm still struggling with the condition. I would have thought the drug would have cleared my system for sure by now, but apparently I still need it. So, but I'm grateful that it's available to me, that I live in Canada and there's no cost. And I go in 2 days a month. You go in and it takes about 2.5 hours to give you the infusion, and you just sit in a chair and I watch videos or listen to my tunes on my iPad, and it's not unpleasant, but I'm looking forward to being able to get back a little more active. I'm still very tired a lot of the time, and it's really hard to schedule my sleep because I'll just wear out and then I'm done. But yeah, I'm feeling much better, and hopefully with a shorter space between the treatments, it'll improve. So that's my story. I'm so grateful for the people in my life, for my wife Marg, and for all the other people who've reached out, and for my bandmates who are so patient with me. And I look forward to being able to reward them back by doing a little more of my part. So I hope that's helpful to some of you. Remember that name of that drug. It's pembrolizumab. If you end up having that prescribed for you, you should probably be aware that this is a potential. I'm not saying don't take it, because I'm a very rare situation, apparently. So to the point where there's really no data about this particular side effect. And they eliminated everything else during that 3-month stay in the hospital that I could have. And it came down to that. And so hopefully you find that informative and helpful, if not maybe just interesting. Have a great day.